Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have on your mind, perhaps you've tried, you've applied, you've done everything that you can possibly do to put the fire out. Well, there's other ways. There's natural ways, things without drugs, without surgery, and we're here to fix that for you and to show you opportunity that you may not have thought about. Broadcasting to you from 105.9 FM and AM 630 WMAL every Sunday at 12 noon. We'd like to have your calls. And by the way, we do have a subject and I have a guest and something that I think that's going to intrigue you today, something that you may never have thought about. You know, when we get beautiful days outside, a lot of us feel really, really good. And when it's cloudy and nasty outside, we kind of feel depressed. There's this thing called emotions, and emotions are variable for so many of us. Unfortunately, too many of us, they're variable, and we can be up and down like a kaleidoscope, if you will, from one end of the spectrum to the other. Emotional triggers, emotional directives, all of those things, whether they're happiness, feelings of motivation, our inability or ability to focus, if you just feel down in the mouth, you feel, upset about something, and it happens automatically, well, there's reasons for that, and they're often connected to something called neurotransmitters, and those neurotransmitters have a very, very specific piece, and you have to understand them. You have to really get them together and to allow you to understand them better and to get me to understand them a little better, because if you talk to my staff, I have a little bit of a yo-yo effect sometimes, not all the time, but sometimes. Somebody you've heard and loved in the past, Dr. Leonard Poe. Dr. Poe.
Good morning.
Hey, it's actually afternoon. I'm the one that has the problem. I've been traveling all over the place, but that's neither here nor there.
So you're in a good mood today or a bad mood today?
I'm actually in a very good mood today.
Now?
Yes.
Okay.
Well, I have to be because I have another grandchild that's going to be born, it looks like this afternoon, and, so all that makes me feel good.
I'm glad.
I know.
We'll keep that mood.
It's good for you. Let's talk about neurotransmitters. We have this computer sitting on our shoulders called the brain, and you have an area of interest, and it has to do with the subject that we're talking about, and you're going to be doing an in-house continuing education program this Wednesday evening at 7:30 p.m. at the Roselle Center for Healing, and you're going to be talking about emotions, and that's a huge
well, that's
topic.
A big umbrella.
So what are you going to talk about?
Well, we're going to talk about it from a couple different angles, but really what I'm going to talk about is neurochemistry and how neurotransmitters affect different things, affect our mood, affects lots of other aspects of our health as well. You really can't separate them out from some other things. But we're going to talk about mood, and we're going to talk about emotions, but then also how those moods, those emotions translate into our physical well-being, how they interfere or I shouldn't say interfere, but how they're also control mechanisms for things like, heart rate, blood pressure, things like that, and how when our moods can change, our physical being can change as well. And how do we balance those things? Like you said, things like weather can sometimes affect it. Why? We talk about things like vitamin D during the winter being lower than what it normally is throughout the rest of the year. Different things like that. What are all the different pieces that go into it?
So when we talk about neurotransmitters, but more importantly, when we talk about emotions, we're talking about things like depression and upset and lifelessness, and sometimes high levels of feel-good juice seems to be coursing into our body, and everything in between. And if we really look at it, there are a tremendous amount of emotions, literally not only hundreds but even thousands if you dissect it down, but they all come from a very specific game plan. If you don't have something called neurotransmitters in balance at the levels that you need them, if they're depleted in any way, then your whole mood structure is going to shift.
Well, that's the real, and you kind of said that earlier, sometimes we have ups and downs, sometimes we're stuck in a rut, sometimes we're stuck in these emotional patterns, and sometimes they're just kind of all over the place. And that's the thing, is finding the balance, but really being able to identify, well, which neurotransmitters are the ones that really need to be affected? Which ones are you either low on? Which ones do you have too many of? You're not converting correctly. And really, it's the conversion piece is a big deal. People are, you see patients all the time. They're low on things like magnesium. They're low on things like B6. We chew it up too much. We don't have enough, and we can't convert those neurotransmitters properly, so we get stuck. Sleep. If we're not converting those neurotransmitters in melatonin, lots of times we have problems with sleep. So it's figuring out the balance between all those, figuring out where you're stuck and why, and then you can fix a whole lot of stuff with how you feel.
And neurotransmitters, kept in balance, or the deficiencies, or the inability for them to target where they're supposed to go, we call that a barrier. And
right.
It can be a blood-brain barrier, it could be a gut-brain barrier, it could be all kinds of things. And just basically what we're saying is that it's an inability to cross over to trigger the reactions that they're supposed to cause.
Right.
Right? So the problem is that we have to understand this juggernaut, if you will, and whether we're upbeat, we're happy, we're down, we're depressed, we're sitting on pins and needles, to coin a colloquial phrase. All those things have to do with neurotransmission, and in this situation, structural, chemical, emotional are really tied in. We have this emotional piece, and now we're talking about the chemical, structural, injury patterns. There's something that we look for when we deal with our patients, and maybe can shed a little bit of light on it when it comes to this situation. We fix it through acupuncture points and affirmations and so forth, but it's called psychological reversal, where a patient comes in and they tell us, we want to be well. I'll do whatever I need to do. But there's something on a subconscious level as well that's saying no. Now,
we see it all the time.
So how does that play into what we're talking about?
Well, unfortunately, and this is where we kind of have to break up with what's going on in our conscious mind and really how that neurochemistry is wiring us, because sometimes they're two completely different things. Sometimes, we say we want to get well, or we say, the example I'll use a lot of times with people that patients often get is, I don't want to be angry at this person anymore. I really want to be over this situation, but I just can't get over it. I just can't stop being angry about this.
They get into a loop.
Yeah, you get into this loop. It's, and a lot of that is if your neurochemistry is continually geared for one reason or another towards anger or towards sadness or, towards a particular emotion, it's very hard to get the mind around that because the physiology is still pointing you in that direction all the time.
So neurotransmission, we've got all of these things in there. If we don't have them in balance, we can have a sense of worthlessness. We can have a sense of not having significance. All of those things are there. They're absolute active types of things, and it has to do. And we're going to get into where these things come from and why they are what they are. But let's talk a little bit about the different types of neurotransmitters, and we'll use things like there's feel-good juice neurotransmitters. There are things that are inhibitory or suppressive, and then there are things that trigger the release of certain hormones in the body as well. And all these things line up based on the topic that we're talking about.
And this is where, like you said earlier, you can't separate that triangle with this one because neurotransmitters. And I always talk to this about patients of mine that you can't really separate neurotransmitters away from parts of the immune system and parts of the endocrine system because they all balance each other out. So you're talking biochemistry is involved there. That barrier system is involved. It affects so much of what we do.
This Wednesday evening, Dr. Leonard Poe will be your presenter, your host at the Roselle Center for Healing in Fairfax. He's going to be talking about your emotions and why they happen, and sometimes you don't know why they're taking place, and no matter what you do, you think you got to go to a psychologist, a psychiatrist, and it's really about the balances that become imbalanced because of trauma, because of chemistry, because of all those things. I want to show you how to fix them. If you'd like to attend that lecture, give my office a call. It's 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday, the 8th of August at 7:30 p.m. And please be our guest. Remember, these are a gift to you from our office. The only thing that we do require and request from you is a reservation, because once our facility is full, it's full, and that's that. So if you'd like to attend this Wednesday's presentation on emotions, be there. I'm going to be there, actually, because a lot of people are going to encourage me to be there.
We need to balance you a little bit.
I know. So let's talk about the different neurotransmitters. I know how I'm going to skip around that real quickly. Our number here is 888-630-9625, 888-630-WMAL. Talk about the feel-good, the euphoric type of neurotransmitters. Those guys that, that just all of a sudden one day we're having a great day. And we don't know why we're having it or how we're having it, but, the juice is there.
The big one for that is dopamine, typically. There's some other ones that are involved in that, but dopamine's probably the big one that people often get low on.
Well, the mood-elevating endorphins that we have, those are the ones that, everybody likes to be around us.
Yeah, those are the happy ones.
Those are the happy juices. And, they actually will kill pain, too.
Yeah.
When you got them cranked up high enough, you don't feel anything. Life is good. And my problem is that more people wish that I had more of those things, on a day-to-day basis. But be careful, Dr. Poe. So,
exercise.
Yes, exercise.
We can talk about exercise because that helps production of things like endorphins.
That's right. But they're produced where?
In the brain. Well,
they affect the brain.
You're talking about
Yes. Mm-hmm.
Well, we won't make it so. We'll make it simple. Okay.
We'll make it simple.
Neurotransmitters across the board. Okay. They're produced in two places. They're produced in the brain. They're also produced in the peripheral system, which is anything outside the brain. For the purposes of this conversation, anything outside of the brain we'll talk about. So a lot of them are made in the gut as well, and that's why that brain-gut axis is so important in general for a lot of what we do. So much of it comes back to the gut.
Actually, most of it.
And what you're eating and what you're not eating and the health of that thing. But especially when we talk about neurotransmitters, because, and this is where we have those feelings, like sometimes we see something that's just absolutely horrible. You see an accident on the side of the road and somebody's dead and you feel horrible and, you get sick to your stomach. There's that connection, that emotional connection with how the gut feels, or you're nervous about something. You get butterflies in your
or
in your
down
stomach.
Deeply depressed.
Yeah, it affects our physiology as well. It's not just our mood, but it's also our physiology.
We've been aware of this for years in healthcare, particularly in the natural healthcare community. Years ago, in a book that I quote often, as you know, is called Sugar Blues, and it was written in the late 60s, 1970, and it talks about what happens when blood sugars go crazy and they go up and down, almost a bipolar type of situation. But this is what we're talking about. What it's affecting are the neurotransmitters.
If you can't get blood sugar balance right, you're not going to be able to balance any of those neurotransmitters out, and then you're going to be stuck in this horrible cycle of poor treatment of, you're not really sick, it's just all in your brain, and you just need to be on, SSRIs or, the other antidepressant medication, and that's just not right.
Well,
that's not how it is at all.
Yeah, norepinephrine and epinephrine used to be called adrenaline.
And noradrenaline.
And now, but those cycles have to do a lot with many things, including sexual arousal, including attraction, including
the whole fight or flight system.
That's right.
I mean, it's across the board.
That's our old friend, the adrenal glands.
That's where we started getting confused with, well, are these really neurotransmitters or are they hormones? Which ones are they? Because we really can't separate the two anymore.
But don't the neurotransmitters trigger the hormones?
Or reverse.
So you have a feedback.
They all speak the same language. They all know what the other one's doing.
888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We're talking about your moods and why you become moody or why you become happy or all those things in between. It's identifiable. We just have to figure out what it is. This Wednesday evening, Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about your emotions and how they relate to neurotransmitters and what that really means for you, and kind of clear up the subject. And he's going to talk about what you can actually do to fix these things, because they're really fixable. So we'll talk about, the pain patterns. We're going to talk about the different hormone patterns in your body, why you've been going, and actually many of you have been doing a lot of natural things the right way, and it still doesn't work. Well, there's a piece that might be missing, and this is the huge piece. Whether it's stress, whether it's anxiety, whether it's pain, any of those things, this is your opportunity to find out. This Wednesday evening, the 8th of August, 7:30 p.m. Please be our guest. All you have to do is call 703-698-7117, 703-698-7117. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about your emotions, your moods, and why they take place like a yo-yo sometimes, up and down and round, and you don't know who's you, and sometimes it's not a really nice thing to be you, So if you'd like to find out how to fix that, this Wednesday evening, August the 8th, 7:30 p.m. at the Roselle Center for Healing, Dr. Leonard Poe will be your presenter, your host, and he is my guest in studio, and we're talking about those things. If you'd like to attend that class, 703-698-7117. That's 703-698-7117. Before the break, we were talking about the different types of neurotransmitters. We know that there's upregulators, things that make you feel good, inhibitory, and then there's hormonal. and a lot of things that go along with that. But we're talking about how neurotransmitters are made, and why some people are depleted, and why some people have way too much, and why some people who apparently have enough can't get into the brain. Why?
Well, it's usually, we talk about not having enough. It's usually the inhibitory ones that we don't have enough of. Things like, serotonin, things like GABA, those types of neurotransmitters. You got to understand that all neurotransmitters are made from amino acids, and amino acids come from proteins. So, like I said, a lot of this goes back to the gut and actually being able to, one, make sure that you're getting enough protein in the diet, you're digesting it properly, which we know most people have problems with digestion. It's just you're not getting enough stomach acid. You're not, especially if you're on something like any kind of proton pump inhibitor, any kind of antacid, you're not going to break down those proteins effectively. And then there's the whole question of absorption. How many of us are actually absorbing them and getting them processed out properly? You need things like iron. So any kind of anemia is going to affect that. You've got to get this stuff out of the gut, these amino acids out of the gut, and actually get them up, not just made. You don't want all your neurotransmitters being made in the gut. You've got to make some in the brain as well. So you got to actually get them up, get them out, get them to the brain, and where they can be then converted into the neurotransmitters and change. And then you got to have all the cofactors to go with it.
There's a lot of things that affect their absorption and also production. Just things that we're doing on a day-to-day basis, from the foods that we eat, the drugs that we take, the cigarettes that we smoke, all of those things.
We put too many things in that are going to block that. They're going to change them and alter them. Caffeine, sugars, tobacco, all those things. They change, they alter it, and you cannot have those things in the diet and them not affect your neurotransmitters. So it's going to affect your physiology, or it's going to affect your mood.
When we talk about endorphins, people hear that feel-good juice type of thing. We're talking about endorphins causing things like, we have that motivation, that attraction to another human being. If your endorphin levels aren't adequate, then a lot of guys, a lot of women will come in and say, I've lost that feeling. I'm not attracted to whoever anymore. I don't want to have anybody touch me, or that sort of thing. That's an endorphin response. Mm-hmm. And it has to do with a lot of different things. But in today's world, one of the things that we look at all the time are drug use, but also the types of foods, because there's so much of the food that we're eating are loaded with sugars, and sugar is one of the primary things that's going to affect endorphin production.
Mm-hmm. Very much.
So,
think about it. How much sugar's in the normal average person's diet? There's a ton. It's hidden everywhere.
Oh, it's awful. It's awful. We often say in lectures that, years ago at the time of inception of this country, the average consumption of sugar per year per person was 14 pounds. Today, 200 plus years later, the average consumption per person is something in the neighborhood of about 170 pounds.
Yeah, it's absolutely ridiculous.
It's awful, and some people get more. That's why we're overfed, overfat, and are
sick.
We're a sick society, and it
chronically sick.
Comes down to what we're talking about.
Yeah.
Amino acids make neurotransmitters. Mm-hmm. How does that happen, and why do some people not get enough amino acids in their diet?
Well, like I said, it comes from protein. So if you're not consuming enough protein to begin with, you're not going to get them. I see this problem a lot of times with, and I know I'm going to get phone calls or nasty emails about this, but vegans and vegetarians, a lot of times, protein levels are typically lower because you're not getting the best proteins.
And most so because somebody who is a vegan doesn't do it right. Most vegans
that's
don't
the problem.
Do it the right way.
You can do it the right way, and you can be very healthy, but being vegetarian means that you eat lots of vegetables. It doesn't mean you eat nothing but macaroni and cheese.
Yeah, or bread or any of the starches, which leads to another problem.
Yeah. Most of them are on a very high sugar diet, which complicates it even further. But you've got to get the proteins in, and then you've got to be able to digest them. And that's, like I said, the digestion and the absorption is the other big piece that most people just don't do well with.
We talk about serotonin. We're talking about things that can cause depression, and it can also cause obsession, obsessive compulsive types of behavior. That has to do with serotonin, sleep problems, irritability, hunger, even low self-esteem.
Well, serotonin's a big one, and that ties in. I talk how this one ties in a lot of times as well with thyroid function, because it's serotonin in the brain that actually upregulates the hypothalamus pituitary gland to release their hormones to stimulate the thyroid, and ultimately in the cells, it's serotonin that causes the cells to be receptive towards thyroid hormone.
If you'd like to know more about this subject, this Wednesday evening, August the 8th, 7:30 p.m., Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing. This is what we're going to be talking about, emotions and how they affect you in so many different ways, but from the place of neurotransmitters and why that happens and brain injury and patterns, and we're going to get a little bit more into that after the break. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I am in studio. We are in studio. 888-630-9625. 888-630-WMAL. Love to talk to you. We're talking about emotions and how they are affected, and we're talking about the neurochemistry. We're talking about neurotransmitters and all those things that make you go up and down the emotional scale on a day-to-day basis, and you don't know why. Well, we're telling you why, and we'll show you how to fix it. But before we get back into the topic deeply, we have a couple calls. And Deborah, are you there?
Yes, I am.
Thank you for calling. Appreciate it.
Oh, thank you for having me.
How can we help you?
Well, my fiance, he is actually on, I guess it's Prozac. He has a lot of allergies, and, we are noticing that there is that brain interaction. Surprisingly, though, when he sits down to eat something, and we're not always sure what triggers, these problems that he has with maybe the foods, his emotions can change very quickly, while sitting down with a meal. And I just was wondering, one, if there's a way to figure out what those items are, because we're not having a lot of success with allergists.
Yes.
And two, if that's even, he's thinking, gosh, maybe this is psychosomatic, but
no,
we've seen it change so quickly and so rapidly and so many times that I really think it's a real condition.
No, it's a very very definitely a real condition, and what you're talking about is something called a brain allergy phenomena, and it starts with what he puts in his mouth hitting the intestinal tract, and the body's not being able to handle it, and you end up with immune reactions. But I'm going to have Dr. Poe take you through it. The short answer is yes, it can be fixed. And unfortunately, in allopathic arena, they don't fix it well. They can't even figure it out sometimes. So let's go from there.
Yeah, I could spend the rest of the program talking about this in particular. No, this is something we see quite a bit. And I'll give you an example. Myself, I have a gluten allergy. And if I have any kind of gluten, if I have breads or anything like that, the office staff won't even let me be around it, because if I get a hold of any of it, I turn in just the meanest SOB there is.
And then we ask them to leave the office.
I get impatient. I get angry very easily because it affects my dopamine levels. Okay. Different kinds of foods can do that across the board. Sugars, gluten seems to be a big one, because gluten will break down not only that gut barrier and lead to other kinds of problems with allergy patterns, but it can also break down what we call the blood-brain barrier. You essentially have the same kind of barrier system in the brain that you do in the gut. And if that barrier system in the brain gets broken down, then it's real easy for brain chemistry to shift and change. And different kinds of foods, sugars, things like that will do that very easily. Now, the problem you're having with the allergist is, and this is where we get into very strict disciplinary values of what we call an allergy. In regards to that, they're looking at things called IgEs, which are a very particular type of allergy. You've got IgA allergies. You've got IgG allergies. There's all sorts of different ones. The way, we approach it and when we look at it with patients is I don't really care which one it is to begin with. I just want to know, is it bad for you? If it is, then let's get it out of your system. Let's have you stop eating it. Let's start repairing those barrier systems. And you will see the mood shift. Once you start to identify some of those pieces, you see the mood shift very, very quickly.
Almost immediately.
My son is the same way. He has the same kind of pattern with gluten that I have, except he goes into this very ADHD type of pattern. If he gets a hold of it, he's uncontrollable. And it's almost immediate. It's within the first couple minutes of consuming it, he's bouncing off the walls. So it's a matter of really identifying it and figuring out, okay, what are the things that you're allergic to or sensitive to or toxic to, and getting those things out of the diet, then making sure you're going back and repairing those systems.
Some people can do it with alcohol and things that convert into alcohol very quickly. It can be things that trigger high levels of mold, by the way, and the reason mold is important, the side product of mold is aldehyde, which is an alcohol. And all of these things, as Dr. Poe was laying out, can be an immediate response depending on where the levels are. If the intestinal tract isn't working, then you have a greater tendency. But what you're talking about in the unfortunate situation is that until he these things are identified and then desensitized and then allowing the body to heal, he's going to continue to react. But the good news is it's very fixable.
Yeah, absolutely.
Great.
Absolutely fixable.
You know what?
You don't have to manage it with Prozac. You can absolutely fix this, heal those systems, and it's not problematic anymore. Well,
the first thing that I would have you do, Deborah, is have you and your fiancé come to the class Wednesday night and really learn about it. And we do these things in our office all the time. And it's if you go in, you can see some of the things that we've done over the years. There was a young girl that I treated about a year and a half ago that had seizures and went into anaphylaxis because of the same type of thing that we're talking about now. And we were able to treat her. She'd been all over the country. She'd been treated by one of the top people out of Johns Hopkins, and nobody could help her until she came, and we actually found out what it was, desensitized, fix the gut, fix her fight-flight system, and, you know, she was a brand new human being where nobody else was able to touch it. So, yes, we can help, but the first thing is education. So if you would like to join us this Wednesday evening, just give our office a call, 703-698-7117, and just tell my staff that you guys will be there, and you're going to learn a lot.
Okay, and can you just address, are we leaving messages at that number? Because it's Sunday.
Okay. It's Sunday. Okay. So what they do is that you'll call in today, you'll leave a message, and then my staff, first thing tomorrow morning, start pulling the numbers off, and then they start calling back throughout the day tomorrow, and then scheduling the class. And then once they get to a place where we're full, then the phone calls after that are simply say, I'm sorry that, you know, we're full. And so the faster you get it, the more likely is that you'll get a seat.
Okay, well, thank you so much. I really appreciate it, doctors. First, I've heard of it, and it sounds like something we really need. So
well, it can be fixed, so don't lose heart, okay?
Okay.
Take care. Thanks for your call, Deborah. 888-630-9625, 888-630-WMAL. It's fixable.
It's amazingly, it's a very simple fix. It's a matter of figuring out a few things, and it's, you know, It's a lot cheaper to not eat certain foods than to have to, you know, pay for Prozac the rest of your life.
I know. And, you know, the
terrible.
Thing, Prozac or couch time or whatever it is. Yeah. I mean, these are not things that are, you know, things that happen to us in our life that are causing problems. These are things that, you know, your emotions go high and low, they go crazy, you react, you almost, in some cases, people will get violent.
Yeah.
And, you know, I have the same problem. I have the same gluten allergy, and I've dealt with it over a period of years, and when I get to that place, if somebody pushes my button, I'm not somebody you want to deal with.
I love to push your buttons.
Yes, you do. I was wondering if you were going to jump on that. But having said that...
You want to talk about acetylcholine next, which is good for memory?
Yeah, let's talk about acetylcholine. I've been taking a lot of that lately. Neurotransmitters. Let's talk a little bit about...
You need it.
Be nice. This is my program, remember?
I know. I can still poke you a little bit.
I won't invite you back. Let's talk about how neurotransmitters are linked into, we talked a little bit about vegans and why they don't get enough of the amino acids, but they're linked to all kinds of other things. They're linked to certain vitamins and minerals and support systems.
Yeah, that's the really kind of the other little piece that sometimes is the easiest thing, is that, you know, we don't just consume neurotransmitters and then they're there. You know, you've got to start with the amino acid. It's got to be changed, and just like any other enzyme or hormone or anything else in the body, it starts off as one thing and it's altered and changed and added in, and eventually you get the end product. Same thing with neurotransmitters. And you need things like magnesium, B6. There's all these regulating steps that go in there. And so sometimes it's as simple as you're not getting enough B6 in your diet.
You know, there's an interesting article that I came across, and it says that there's 2 key amino acids to all this nonsense of emotions. And if you don't have them, no matter what you do, you can't fix anything. One's phenylalanine, the other one is glutamine. Mm-hmm. What's that got to do with the price of beans, as they say?
Well, one with glutamine, I mean, we see that patients need that an awful lot of the time. You've got to have that to be able to
fix the gut.
To fix the gut, to get those things, you know, so you can actually get them across in the blood-brain barrier, or cross actually out of the intestinal tract to the blood-brain barrier. Phenylalanine is another really important one. We don't, people often aren't getting that enough in their diet. They're not getting it absorbed well enough. And you need those to make things important neurotransmitters. You've got to have them in there.
It's part of the feel-good complex. If you don't have phenylalanine, you don't get that motivation. The sex drive is gone. Your body can't utilize and transport sugars into the body the way it's supposed to.
And there's other things like, you want to talk about glutamate?
Let's talk about glutamate.
Glutamate's one that we tend to get a lot of in our diet because it's in things like MSG, monosodium glutamate. That's one of the excitatory neurotransmitters. That's the one that GABA has to constantly try to beat down. So if you're not converting glutamate to GABA properly, or you're just not getting enough GABA made for one reason or another, and you've got this overwhelming amount of glutamate in your system, it's real easy for anxiety to set in. You're anxious all the time.
888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about emotions and why they happen, and your intention and your focus and your drive and all of those things. And when they're out to lunch, sometimes it's a pretty easy fix if you get to somebody who knows what they're talking about. And my guest, your host this Wednesday evening, the 8th of August, knows what he's talking about. 7:30 p.m., Dr. Poe will be presenting a whole conversation with you on emotions. If you'd like to attend and find out why you sometimes do the things that you do and nobody's been able to get a handle on it and get off some of the drugs and medications that you're on, call our office at 703-698-7117. That's 703-698-7117. By the way, we're really easy to get to. Capitol Beltway, Route 50, about a third of a mile off. We're in the Red Cross building, and it's fast. It's right there. And now, thank God, the construction's going away on the Beltway, and I'm happy boy, and so are a lot of our patients. And, it's just like I've been avoiding that thing forever. But Wednesday night shouldn't be a problem, so please join us, but give us a call. Let's talk a little bit about the different types of challenges that have to do. We talked a little bit about diet. We've been talking about the blood-brain barrier and why, inflammatory levels because of the things that we've talked about.
Inflammatory. Let's talk about pain.
Okay, we'll talk about pain.
We'll talk about pain. You said inflammatory levels.
Let's talk about pain.
Which is a big piece of it. A lot of the pain that we get, we talk about something like, like a disease like fibromyalgia.
That's a good one to talk about.
These types of pain syndromes that we get, or we used to call it RSD, but now we call it complex regional pain syndromes. I mean, things like that. These are all neurotransmitter-mediated pains. We have elevations in things like histamine, which is a neurotransmitter, substance P, things like that. If your inhibitory neurotransmitters, things like serotonin, are very low, it's very hard to get those pain patterns put back down. Why do you think they put people who have things like fibromyalgia on, depression medication? It's because of the way it regulates the serotonin.
That's right. If you don't have serotonin in proper balance, if it's way too high or way too low, you can end up with excitatory problems that cause pain. The
neurotransmitters sometimes are that missing piece as to why you can't get out of the pain. And then it comes back to the question of why are those neurotransmitters out of balance, and we go back to the whole gut and everything else. But for a lot of patients, that's the missing piece. That's why we can't get out of pain.
The other thing is the cofactors, too. The things that are stimulatory to the production of the things that we're talking about.
Yeah.
And that goes back to diet. It goes back to depletion of diet. The foods that we're getting today, even though that you think you're getting something decent, if it's been grown with junk on it and pesticides on it, and you're blocking all these things, you're increasing the blood-brain barrier problems, and that's why we're a sick society.
It's grown in dead soil to begin with. It's just not nutrient-rich. I mean, what is it? What was it was like you have to triple your caloric intake now to get all the nutrients you need from your diet, and of course that's not healthy for you to do that either.
No. And unfortunately in our society people are tripling their carbohydrate and sugar intake, and all the stuff that are fast acting that they can grab and run, and their diets are so depleted they're not getting anything. They say, well, I'm taking a vitamin. Well, you know what? Your vitamin is, in most cases, if you're getting them off the shelf someplace and you're not asking for good quality, is synthetic. It's made from petroleum products.
Yeah, it's junk.
You don't want to put oil in your body.
You're getting like 3,000 pills for $1, but you're wasting $1.
Pretty much.
Yeah,
and causing other deficiencies that you didn't even have to begin with.
It's, the number of patients that I'll collectively say we see that have problems with blood sugar metabolism, that have problems with anemias, that just aren't getting the nutrients in that they need. It's no wonder that those levels aren't well balanced.
This Wednesday evening, I know that you're going to get into very, very specific situations, and you're going to show people how they got to where they got and how to put the fire out. But before we do that, let's go to the phones. Luke, how can I help you, sir? Luke?
Yeah, I'm here.
How can I help you, sir? What would you like to know today?
I have a very good friend who is complained years ago of having had nickel put into her gums in some way through a dental procedure.
Okay.
And she realizes now, from having seen many doctors, that she has heavy metal in her blood system, and she's suffering from that. And I just would like her to come see you, but I have to kind of sell her on the idea of, seeing another doctor. So what should I tell her?
Well, the first thing you tell her is, why don't you have a date with her Wednesday night and bring her over to the class and tell her that she's going to learn a whole lot about how to take care of her health, wellness potentials, and so forth. You don't even have to tell her that you're setting her up. Just bring her over and let her listen to the presentation. It's going to be straight up, and she can ask any question that she wants.
Right.
Trust me, that's probably, education is the best way. And with all of our patients, what we try to do is we try to educate them so they understand how things happen. And then the decision becomes hers, and it's not even a backdoor on your part to try to get her to do something. So I would encourage you to do that first. Obviously she's more than welcome to call us here on the air, and we'll handle it. But the program Wednesday evening is going to be very specific, very detailed. It's going to unfold how these things happen. He'll talk a little bit about that piece of it and how they block neurotransmission. And she can also write me at rosellecare.com, ROSELLECARE.com, and ask me a question, and I will get back to her, and I will, lay it out for her very, very specifically. But Luke, that's how you do it. I appreciate it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We have been in studio at 888-630-WMAL, just like we are every Sunday at 12 noon, bringing you the most up-to-date information that we possibly can and giving you an insight of things that you may not have thought about on your own or were told that weren't possible, because you know what? The body is able to turn things around. You just have to have the knowledge, the understanding, and the direction, not to do the things that, may have been inappropriate, making things worse. This Wednesday evening, you're going to find out how to make things better with your emotions and why they happen, and sometimes as simply as making a few changes, and sometimes there's other pathways that you have to explore as well. But this Wednesday evening, 7:30 p.m., August the 8th, at the Roselle Center for Healing, Dr. Leonard Poe will be your host, your presenter. I would encourage you, if you have any problems or you have anybody in your life that's having a problem, that this is a class you really want to attend. 703-698-7117. Also, I'd like to remind you that coming up October the 20th, Ageless Health 2012 is almost here, and please don't wait to register, because we're going to come up to that place where we're going to be a full house, and then that's it. We really only have a limited amount of space. And this year, Dr. Evan Mladenoff, my friend, national, international speaker, doc for the Kansas City Chiefs, he is going to be one of our presenters. He's going to be there. You're going to enjoy him. You're going to enjoy the information that you're going to get. And if you come this Wednesday evening to Dr. Poe's class, you're going to find out how to actually save on that class in October. So you have a double whammy. So 703-698-7117. Let's talk about the class, Dr. Poe. Let's talk about what it is that you're going to actually talk about. Why should people come?
Well, giving a class on neurotransmitters would be kind of like giving a class on hormones. There's an awful lot that we could talk about. So we're going to break it up into some really easy pieces. We're going to go over some of the major neurotransmitters, the things that we've heard of before, things like serotonin, dopamine, GABA, things like that. Those are ones that people are have mostly heard of. So we're going to go through those, but then we're going to relate them to, well, how do these factor into things like, some of the mood disorder things like depression, anxiety, even things like bipolarism, dementia, things like that. How do those play a role in those? We're going to talk about the difference between those neurotransmitters in the brain and the ones made in the rest of the body, how they affect our physiology as well, how they're tied into other kinds of things, pain pattern diseases, like we said, like fibromyalgia, but also other kinds of endocrine disorders, things like diabetes, for example, or problems with thyroid. We're going to talk about all those pieces, how they interact, but then how do we get there, and talk about that gut-brain axis that goes on.
So let me ask you a question. The conditions that we treat in our office and most physicians treat, if you had to divide them up, those conditions who have a direct neurotransmitter component and those that don't, how many have a direct neurotransmitter component?
I would say probably everything we do in the office has a direct neurotransmitter component,
Yeah,
because the adjustment itself is going to upregulate neurotransmitters for you.
Yeah, when you're looking at how the body responds, it's really about these neurotransmitters, and this is the important piece. If you really want to understand how the body heals, how things change in the body, how immune system gets upregulated or down and suppressed.
Yeah.
I mean, this is really, it comes down to, we're learning so much more about how chemistry works.
Broad stroke, neurotransmitters, those are the working chemical components of the nervous system. And there's nothing that happens in the body without nervous system direction.
I mean, there are many pieces that are associated with it, but to have things actually be fixed and hold corrections, whether you're dealing with acupuncture, you're dealing with dietary
No, this
changes.
is not Band-Aid care. We're not.
No, we're not doing it with Band-Aid care. What I'm saying is that you got to understand this piece as well.
And this is a fixable component.
Very fixable.
It's just a matter of identifying it.
This Wednesday evening, 703-698-7117. We invite you. We encourage you. Please show. These classes are for you. We do them every other week on different subjects, different topics. If you have something or someone that is not as calm as you'd like them to be, this is a class where you need to be. You're listening to Dr. Tom Roselle Live. We're here every Sunday and trying to stimulate your thought process to realize that your health is in your hands, that health is a do-it-yourself program. We'll see you next week. Be well. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.